come in.
Hand hygiene, provide privacy. Hey, my name is Chris. I'll be your nurse today. Can you please tell me your name and date of birth?
Caitlin Mayo, 10/27/2000.
Alright. Well, I got orders from the doctor to perform a head-to-toe assessment. Are you okay with that? Alright, before we get started, are you in any kind of pain?
I'm not.
Alright, well, can you tell me where you are?
The doctor's office.
What brought you in today?
A routine checkup.
Alright, who's the current president of the United States?
Joe Biden.
Joe Biden. Alright. And can you tell me your name again?
Caitlin Mayo.
Alright. She is oriented times 4. Situation, person, time, and event. She's alert. She kept eye contact. Her speech, vision, that's how it should be. Like I said, she was responding to me appropriately. She's dressed appropriately for the season. Well groomed. There's no obvious physical deformities. That being said, we're going to move into the head part of the assessment. Is that okay with you? But before that, the Glasgow Coma Scale. This assesses for coma, and it assesses your verbal response, your visual response, and your motor response. All right. I'll start with head. Inspecting the scalp for any lumps or bumps, lacerations, contusions, and also to see if the hair is evenly distributed. All right. It is, and it seems to be well taken care of. It's not oily. There's no bugs or anything of that nature in it. So everything's fine there. Her head is normocephalic. It is proportional to her body. Have you had any headaches? Okay. All right. Well, we're going to now assess the ears. Can you tuck your hair behind your ears? Ears appear to be symmetrical. They are even in height on both sides of the head. Have you had any changes in hearing recently? Any drainage? All right, we're gonna do a hearing test and whisper test. I'm gonna whisper a word and I want you to recite it to me.
Okay. Tree. Chair.
All right, you heard both of those words correctly. Your hearing is intact. Now we're gonna assess the eyes. Have you had any visual changes, any drainage from the eyes, anything like that? All right. We're going to do direct, consensual, and accommodation. We're going to start with the right eye. We're going to shine into it, and that's direct. Assess the pupil. Then we're going to shine in the right eye again, but look at the left side, or the left eye, and see if it does the same thing as the eye that's getting the light shown in it. That's consensual. Alright. Eyes react to light as they should be, as expected. They're normal. Pupil size is it's approximately a 4 millimeter. That's fine. We are now going to assess accommodation. Can you look at the pen? Look at the wall past me. Then look back at the pen light. Alright, her pupils dilate when she looks at the wall past me and constrict when she puts her focus back on the pen light. Now we're going to assess the nose. Eyes are symmetrical, by the way. Assess the nose. It is symmetrical, it's midline, and now we're going to assess the nares. Nares are good. No abnormal findings in there. Now the mouth. Have you had any drainage out of your nose? Any alteration in smelling? Alright, can you cover one nostril and breathe in the other? Alright, good. Now the other. Any difficulty with either one? Okay. Alright, now we're going to assess the mouth. Alright. Oral mucosa is pink and moist. There's no sign of tooth decay, loose teeth. Are you experiencing any pain in your mouth? Irritation of the gums, anything like that? Okay. Now we're going to assess for swallowing with the neck and all that. You swallow? Alright. Any difficulty swallowing? All right. Trachea is midline. That being said, we're going to assess for the temperature. All the way down. Legs. Normally on the skin, of course. All right. Skin is warm to the touch. That's expected. Everything seems to be fine there. One side is not any cooler or warmer than the other. Now we're going to assess the jugular, or assess for jugular disdain. Jugular vein distension. That's it. Can you slide down a 45-degree angle and look to your right? All right, now the left. All right, no JVD is present. There is no right-sided heart failure. Now, while I'm up there, I'm going to assess for skin turgor, right below the collarbone. It recoils immediately. Elasticity is good. Now we're going to move into the cardiac part of the assessment. Is that okay with you?
Mm-hmm.
We're going to start with the right side, and that is the aortic, and then move to the second intercostal space on the left side. That is pulmonic. The third intercostal space is Erb's point. Fourth is tricuspid, and fifth is mitral, apical, and apex. And you will listen to that sound for a full minute, and that is mid-clavicular. Start with the aortic. S1 and S2 are present. No adventitious sounds. If S3 and S4 S3 and S4 were present, you flip the stethoscope over and use the bell of the stethoscope. And normally it's skin to diaphragm or bell contact. For the purpose of the video, we're doing it on top of the clothes. Now the pulses, you have the carotid that you would assess, not bilaterally. And then you have the axillary, the brachial, the radial, and you would check these bilaterally also. Alright, it is 2+, palpable, and regular. Then you have the femoral on the back of the knee, popliteal, on top of the foot is dorsalis pedis, and behind the ankle is posterior tibial. Yeah, have you had any chest pain or anything like that? Not recently? Okay. Alright. Now going to move into before we move into the respiratory part of the assessment, we're going to assess for edema. I'm going to start up here and then work our way down. Yeah. There is no edema, so there's no excess of fluid. Shouldn't be there. I'm going to check the capillary refill now. It is less than 2 seconds or 3 seconds. On the toes. Alright. Now we're going to move into the respiratory part of the assessment. Have you had any shortness of breath? Any cough? Not coughing anything up? Okay, alright. We're going to move into assessing those. We're going to start with the right side, and then move to the left. And we're going to do 4 anteriorly, 2 laterally, and 4 posteriorly. Listen for a full minute. Excuse me. They're going to take a deep breath every time they feel it move, the stethoscope, and this is normally up under the shirt also. You lift your right arm up. On the left. Alright, now lean up for me. Alright. No adventitious breath sounds. Everything seems to be normal. Nothing abnormal was heard. We're now going to move into the teaching you how to use a spirometer. Have you ever used one?
I haven't.
Alright. That's your incentive spirometer. What you're going to do is take it and inhale as much as you can and see how high you can get the gauge, and do this 10 times every hour that you're awake. And what the incentive spirometer does is help expand your lungs and help prevent against pneumonia. Another method for this is the turn, cough, and deep breathe. You're going to want to do this as often as you can or fill up to it. And this helps clear your lungs also.
Okay.
Alright. I'm going to move into the musculoskeletal part of this assessment. Okay with you?
Mm-hmm.
Alright. We're going to start with the elbow. Can you flex for me? Extend. Alright. The other. Flex. Extend. Flex. Extend. Flex. Extend. Alright. I'm going to do the wrist also. Can you flex? Extend. Flex. Extend. Alright. Feel a little resistance as it should. Flex. Extend. Flex. Extend. Alright. I'm going to do the two lower extremities too. Two parts on the lower extremities. Can you flex your knee? Extend. Alright. Dorsiflex. The plantar flexion. Alright. Come over here, flex your knee. Extend. Dorsiflex. Plantar flex. Alright. Can you flex your knee? Extend. Dorsiflex. Plantar flexion. Flex. Extend. Dorsiflex. Plantar. Alright. Feel resistance on every one of those. Have you been experiencing any joint pain?
Mm-mm.
None? Anywhere? Okay. Now we're going to assess your gait. Can you stand up for me? And walk to the end of the room and then walk back. Alright. Okay. And now do the tandem test. It's going to be heel to toe. Try to walk line. Alright, good deal, good deal. And there's one last test. Excuse me. Feet together. Arms straight out. And close your eyes. Alright. Keep your balance. Your walk was good. Nothing seemed to be off. Everything was what it should be. You have a seat for me? I'm going to now assess the abdomen. Normally you'll do it on like a exam table or the bed, excuse me, lay them down flat. But for this, we're just going to ask you to lean back a little bit or scoot down your chair. We're going to assess the abdomen first, palpate second, inspect it for skin color. Are there any abdominal moles, any bumps, anything like that, any distension? After that, everything's good. Skin is appropriate for ethnicity. Now we're going to palpate. Have you had any tenderness? Okay. Well, before we palpate, we're going to auscultate. And we're going to start with the right lower quadrant and go to the right upper, then left upper, and then left lower. And listen for a full minute. Alright. No abnormal bowel sounds. They were normal active. Sounded as like it was healthy. No. To assess for bruise, you would use the bell of the stethoscope and listen right here. Alright. No bruise were heard. So that's good. That's great. We are now going to palpate. And you said there's no tenderness. Alright. And then start with the right lower and do the same pattern. But if they had any tenderness, the quadrant they were feeling the tenderness in, make sure to palpate that last. Alright. I didn't feel any like masses, anything like that. That's what you assess for when you palpate, and if so, it will need further examination or assessment. I didn't feel any of those, so everything was as it should be once again. Can you tell me when your last bowel movement was?
This morning.
Alright, when's the last time you voided?
About an hour ago.
Okay, alright. Any pain when you do any of that? No? Okay, alright. Well, do you have any questions for me?
I don't think so.
Alright, well, you have a good day, and I'll be back to check on you later.
You too. Thank you.